Back pain. Back pain is not an illness. It's a symptom of an injury to the back, damage to a muscle, a ligament, or a tendon, or a disc. 80% of us will suffer from back pain at some stage in our lives. And in the workplace, 33% of all injuries, non-fatal injuries, are due to bad or poor manual handling, lifting of loads. But the good news is that in most cases, the back pain will clear up by itself. However, there are cases where they don't. That's where people will have to go to see their GP for further investigation. It's very important that we understand how our back works, and this will help to protect your back from injury. Okay, so the structure of our back. So this is a model of the spine here. The spine is made up of 33 bones, and those bones are called vertebrae. This is one of those single, it's vertebra, so singular is vertebra and more than one vertebrae. So this is one of your vertebrae. Like I said before, there are 33 of them in total, from the base of your cranium, your skull, right down to the very bottom here, the bottom of your tailbone. 33 vertebrae in total. They are irregular bones, you can see by the shape of this one here. So all of your bones are in a category, long bones and short bones. The vertebra is an irregular shaped bone. There's a small little gap here, a hole at the back, and that's where your spinal cord passes through. And in my model here, you can see the spinal cord is in yellow. These are the peripheral nerves here that carry the information down into your legs and your toes, so you can move and sense things like the sense of touch. You can see the spine here isn't dead straight, nor should it be. You've got 4 natural curves in your spine, and this allows your spine to act like a spring. So when you walk or run, because your head weighs about 5 or 6 kgs, your spine is like a spring, a leaf spring, as you bounce along, it's like absorbing those shocks. Also we have discs, and these are called intervertebral discs. Now there are not discs between all of the vertebrae, so between C1 and C2 at the very top, there is no disc, because that's a synovial joint. And between the bottom 9 vertebrae down here, they are fused together. These are fibrous joints, fused joints. There are no discs here. So from here, which is S1, sacrum number 1, right up as far as C2, cervical vertebra number 2, you have discs. And the disc looks a bit like this here. So there are 3 parts to the disc. The outside part, which is annulus fibrosus, comes from a Latin term like annular rings of 3. It's soft and pliable. And in the middle then, in the nucleus, we have the nucleus pulposus. The nucleus pulposus is like a jelly type of a substance. And the annulus keeps it inside, the annulus fibrosus. And the hyaline cartilage, the third part that I mentioned, it adheres the discs to the vertebra above it and below it. So they also act like shock absorbers. So between the structure of your spine, those 4 curves, and also the discs, it absorbs shock when we lift things, when we exercise, when we run and walk and so on. So the nerves, like I mentioned before, you could send information from your brain down to your spinal cord, to your legs and your feet, and you can move. The joints in your spine, well, you have 3 different joints, synovial joint up here, fibrous joints, fixed joints down here, and these one here are called cartilaginous joints between the discs. The one at the top allows you to move your head from left to right, almost 90 degrees in each direction, 180 degrees in total. The ones at the bottom here, the fibrous joints, they don't move at all, they are fixed. The ones between the vertebrae, they allow you to move a small amount. So between those small degrees of movement, I can rotate my torso 45 degrees to the left and to the right. I can flex my body forward because of the discs, and I can extend my spine backwards. But those facet joints at the rear of the spine, you can see them here as well, they begin to come together, and you can only bend back so far. Okay. Okay, so some common back problems include non-specific back pain. So there's no particular reason for it, and it tends to clear up quite quickly. So the person hasn't gone any further to investigate. And that's quite common. Slip disc, that's where the disc, it doesn't actually slip, so in the term it's called slip disc, but the disc itself, it doesn't slip, it bursts or it splits, and the inside part, the nucleus pulposus, comes out through, and what can happen then is it can put pressure on the peripheral nerves, and especially the next one I'm going to talk about is sciatica, where the sciatic nerve is damaged or pressure is put on it from the nucleus pulposus, and that can cause this radiating pain. So it's not localized anymore to the lower back, it starts to travel down into the legs, into the buttocks, and right down, in some cases, even into the toes, into the big toes and into the small toes. It depends really on which disc is damaged. Spondylosis is another condition, and that's due to wear and tear of the spine. But we all have wear and tear in our spine. From the age of 25 onwards, if you were to have an MRI carried out, there's going to be wear and tear in there, especially if your work that you do is quite manual, maybe in construction and the likes. Lumbago is another one. Lumbago is something that affects people, and it's a common low back problem. And pain is seen in the buttocks area and localized to the lower back, and maybe sometimes goes down into the thighs as well. But it usually lasts for a day or clears up within a couple of weeks. And finally, the neck. The neck is an area as well that can be affected. It's part of the spine. It's the cervical spine. People can get like a stiff neck and just pain in the neck generally. In yoga, we tend to support the head with blocks or with bolster, or even just to roll up a towel in some of the exercises to help with that. Okay, so treatment. Most acute back pain is simple, and it clears up within a short space of time, a day or two or a couple of weeks. It says here that simple back ache usually responds to pain relief, physio, and then the person returns to work. And like I said before, if the condition doesn't improve, a visit to the GP is very important for further investigation. Okay, so finally we're going to talk about protecting your back, and that's prevention is much better than the cure, as with everything else. So how can we protect our back? Well, firstly, posture, improving your posture, how we sit. So if it's in the workplace, we make sure we have the proper equipment, proper chair, proper desk height, screen height, maybe a second screen if you need it, mouse and so on. So we do a display screen equipment assessment, and people are competent, qualified to look at your workstation and make sure it's set up for you, because over time, if you don't have the proper workstation, that can affect your back and cause back pain. Footwear. So footwear, very important that we wear the right footwear for us. Again, if the heels are too high and so on, that can affect your centre of gravity, and over time that can affect your posture and lead to back pain. Lifting correctly. So we, again, in the workplace, we sometimes, we should by right do a manual handling course, and maybe you have done one before. So we would always lift in a certain way. So I teach manual handling, so we always talk about the proper way to lift. We bend our knees, we keep our back straight. The structure of our body, we've got these big muscles in our legs called our quadriceps, and our backside called our glutes. And also, of course, we have those muscles in the hamstrings as well. So you've got a lot of muscles there working together to lift loads like a box or whatever the case may be. But we tend to lift the incorrect way, so we don't use the legs at all. We tend to use the lower back, which might be weak because we haven't exercised our back for years, and that's when you can damage the muscles, the ligaments, the tendons, but also the discs in the back. So the discs take up this wedge shape here, and pulling the discs apart at the rear, pushing the nucleus pulposus to the back of the disc, can cause damage to the disc. So whenever we lift, not just in the workplace, but at home, we should try to lift in a proper way. There are 8 principles of lifting, where we assess before we lift. We take a look at the load itself, the weight of the load, but we take a look at ourselves first. Have we any injuries? Have we got the proper clothing on? And so on. We look at the environment, and then we go ahead and we lift the load, like I would have shown you with the lifting man there. Broad, stable base, bend the knees, back straight, not twisting the spine. In our lives, we should have a proper seat set up in the car to support your back. In your bedroom, we spend 8 hours a day in our bed, so proper bed pillows as well, not too high. so you can maintain that good posture. And probably most importantly is maintaining a healthy weight. So men unfortunately tend to carry weight in their tummy, we tend to carry weight in the belly. So that can tend to pull the pelvis forward and give us this excessive curve here in our lower back. I did mention at the start we have 3 curves, one up here behind your neck, forward curve, a backward curve here in your thoracic spine, a forward curve in your lumbar spine, and a backward curve here in your sacral coccyx area. But if any of those curves are excessive, like this lumbar curve here due to excessive weight, or if female is pregnant, that can cause pain in the back. So maintaining a healthy weight is very important. Again, looking at diet and exercise. And that brings me on to the last thing, protecting your back and prevention. Exercise is hugely important. So I teach Pilates, and in Pilates we work the core muscles. Now the core muscles are not just the tummy, it's everything. The muscles of your core almost wrap around your spine like a corset. So the muscles at the front, the rectus abdominis, the TVA, the transverse abdominis, the muscles to the sides of your torso, the obliques, the internal obliques, the external obliques, and the muscles that run the length of your spine, the erector spinae. And if all of those muscles are worked in an exercise class or in a program, in the gym, through yoga, Pilates, or just doing sit-ups and back extensions and side planks and so on, it develops and strengthens those muscles. Because in our lifestyle nowadays, we do very little exercise. We have to engineer exercise into our day because we've taken out activity. You know, years ago we'd have walked and cycled a lot, and we would have washed our car manually. Nowadays, everything is, you know, we modernised, and we sit in chairs a lot. And when we sit in chairs, the chair supports our back. And then, like everything, if you don't use it, you lose it. So if your back is supported all the time, be it at home or in the workplace, the muscles in your back waste away and they get weaker and weaker. But by doing exercises like Pilates and yoga, we do spine strengthening exercises, working all of those core muscles that I mentioned already to prevent getting back pain in the first place. Thank you for watching. My name is John Heffernan. If you have any questions, please leave a comment below or through the Heart and Head Wellness Initiative email and Instagram page.